Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Welcome to the Rational Wellness Podcast. Our guest today is Dr. Neil Nathan, a medical doctor who's a pioneer in the treatment of complex chronic illnesses, including mold toxicity, Lyme disease, mast cell activation syndrome, multiple chemical sensitivities, and other environmental illnesses. Dr. Nathan has spent 50 years treating some of the most sensitive and complex patients, and he's helped many of them recover their health, and he's been studying and teaching how to treat such patients. He's written a number of books, including On Hope and Healing, Healing is Possible, Mold and Mycotoxins, which was just updated as an ebook in 2022, Toxic, second edition, Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illness, say that 3 times fast, and the Sensitive Patient's Healing Guide. So today, my goal is to pick Dr. Nathan's brain and get some help on learning how to treat complex chronic patients, patients that we often find difficult to treat in our offices as functional medicine practitioners. So, Dr. Nathan, thank you so much for joining us today.
Thanks for having me.
So, many patients with mold toxicity or Lyme disease are often misdiagnosed, sometimes for months or years. What clinical clues should alert practitioners and patients to suspect that they may have such an environmental or biotoxin-driven illness?
Well, I have 2 answers to that question. The first is general, which is if a patient comes in with a whole host of symptoms in many different systemic areas, symptoms involving pain, headaches, shortness of breath, every type of GI symptom, psychological issues, anxiety, depression, OCD, fatigue, cognitive impairment, peripheral neuropathies, and I can go on. If someone comes in with this complex a story, then you have to think about mold and Lyme, because unfortunately, many physicians are not aware of those diagnoses. And when patients come in with all those symptoms, their first reaction is, well, this has got to be in your head. It's got to be psychosomatic. So go see a psychiatrist. And that is doing a grave disservice to those folks because it's not in their head. It's very real. It's just that many practicing healthcare providers haven't heard about mold toxicity or seen enough Lyme that they really know where it's coming from. So number one, anything complicated, think Lyme, think mold. Second, a couple of very specific symptoms that are unique to mold and Lyme. So for example, if someone comes in complaining that they feel a vibration or tremor in their body in different areas, it's not visible, but they feel it and it's very disturbing, that's mold or Bartonella until proven otherwise. If they're experiencing an unusual type of pain, like an ice pick pain or an electrical sensation, again, that's mold, maybe Bartonella, until proven otherwise. So there's a few symptoms that are so unique that as soon as you hear them, it goes, I know what that is. But again, not all practitioners are aware of this.
Do you find that mold and Lyme often coexist in the same patients? And if so, why?
Very much so. The reason is very simple. Mold weakens the immune system, predisposing to Lyme. Lyme weakens the immune system, predisposing to mold. Both are really triggered by a weakening of the immune system. What I mean by that is you could live in a moldy environment. If your immune system is robust, you could have minimal to no symptoms, and other members of your family the same, until your immune system takes a hit. Now, that hit could be a infection like flu. COVID was a big one for setting that off. Surgery, childbirth, an emotional upheaval of any sort. If the immune system takes a hit, it then loses containment, and then whatever you've been exposed to, that could be Lyme, it could be Bartonella, it could be mold, it could be Epstein-Barr virus, it could be other viral infections. Once containment is lost, then we're off to the races. And now someone is in the throes of a serious illness, and now we have to figure out the details on how to figure out how to cure it.
So how do we determine if they have mold toxicity or Lyme? What kind of testing do you find most effective? And feel free to mention specific tests or lab companies.
Okay. So in the mold world, there are 4 laboratories that can measure mycotoxins in different ways. And any of them.
So mycotoxins are what are given off by the mold that's growing in your home or office.
It's mycotoxins that are doing the damage. And mycotoxins is simply a fancy word, toxin with the word myco, M-Y-C-O, which refers to fungus. So mycotoxins are made by molds, and they make us sick. We can measure them now. And so the beauty is we now don't have to guess at it. We can simply collect someone's urine and see if they have mycotoxins in their urine. It's really straightforward. If you have a lot of mycotoxins in your urine, it's coming out of your body. It's there.
Why are conventional physicians skeptical of these urine mycotoxin tests?
Generally, it's because they know nothing about it.
Okay.
You're going to love this argument. The one that I hear the most is, well, if this was a valid concept, they would have taught it to me in medical school. I went to medical school over 50 years ago.
Right.
So let me get this straight. Nobody has learned anything in the last 50 years that I should be aware of, that I was completely, totally, perfectly educated. I mean, that's ridiculous. But
not to mention how many hours are spent in medical school teaching you about environmental toxins, diet, and, any of the things that functional medicine doctors typically deal with.
Well, it hasn't gotten into the medical school curricula. So it's a really silly argument, which is
right.
Nobody taught me this, so it can't actually exist.
Right.
So forgive me, but that's silly. I hear it all the time, actually, but it's really quite silly. I can.
So which are the best mycotoxin tests to do?
Well, all of them will make the diagnosis. In my experience, real time is the one that gives the most consistent results, and the ones that measured over time allow us to know what that body is doing with it. You can get a positive test from Mosaic, from Vibrant Health, and there's a blood test which is really an immune test for mycotoxin antibodies, which is from MyMyco. Again, any of these tests will tell you it's there. Real time does a much better job allowing you to follow the patient's progress in terms of when you're getting the mold toxin out of their body.
Okay.
And that's just my opinion based on tens of thousands of these tests in all of these labs. And I just want all listeners to know I have no financial arrangement, a relationship with any of the laboratories or tests that I'm going to be talking about.
Now, when it comes to mold, mycotoxins are given off by the mold, but the mycotoxins they don't form mold, right?
No. Mycotoxins are small molecules made by mold. Their purpose is, let's get back to nature. I'm talking to you now from my home in Oregon, and I've got in front of me a huge natural park. And in this park, there are probably 1,000 species of mold. Each tree, each plant has its own mold species that gravitates to it. So certain mold species like lodgepole pines or azaleas or rhododendrons or all of the things that are out there. And they make toxins not to make us sick, but to keep other molds out of their ecological environment. It's really pretty simple. That's why they make toxins. Unfortunately, they make toxins when they feel threatened. So when they get into certain situations, like when mold gets into our bodies, our immune system, when it tries to go after the mold and attack it, it makes toxins to protect itself. And then we're off to the races.
Well, one of the questions I have is if mycotoxins don't form mold and we get mycotoxins into our body, why is it that frequently patients with mold toxicity also get colonization of mold or fungus in their body?
Well, it's one and the same. If you're living in a moldy environment, if you live there long enough and you have enough that you're exposed to, the mold will enter your body. And if your immune system has gotten weak, then it will grow there. That's what we call colonization. So the areas of colonization are the ones in closest contact with the outside world. Our sinuses, our gut, primarily. So after a while, mold, fungus is growing in those areas, making toxins. We get mold toxins from the fungal elements that we're inhaling.
Okay, so we're potentially inhaling mold spores as well as mycotoxins.
Yeah. Inhaling and swallowing.
Right. So what are the best tests for Lyme and co-infections?
Not all labs are created equal, and some of the tests that have been in use for a long time are not very accurate.
Okay.
So for many years, the medical profession has used what's called a Lyme antibody test as a screening test before it will do a more elaborate test, more accurate test. It turns out that the screening test is so inaccurate, it's literally like flipping a coin.
And is this the Western blot?
No, this is simply a Lyme antibody test.
Okay.
The Western blot was the follow-up to that, which is if that test was positive, and you only had a 50% chance of getting that, then we would do a Western blot. And that's a very complicated test. What it's measuring is pieces or fragments of the Lyme bacteria that the body is making an antibody to. And we call those bands. So certain bands are common to multiple different kinds of infections, and certain bands are very specific for Lyme. Now, again, the Western blot is an outmoded way of doing that. It was originally came into existence, and it only measures one species of Lyme, Borrelia burgdorferi. And now we know that there's over 30 species of Borrelia. So a Western blot is no longer adequate. It used to be the gold standard.
Right.
Now we do what are called immunoblots, which measure antibodies to multiple species of Lyme, Bartonella, Babesia. They're better, but they're not fully, totally, absolutely comprehensive. Some labs, particularly IGeneX, have for decades been the leader in being on the cutting edge of being as accurate and as expansive as possible.
So you like IGeneX in particular?
Absolutely. But it is, again,
And IGeneX has many different panels. There's the, $1,000 panel, the $2,000 panel, the $3,000 panel.
Again, not everyone needs the whole expensive panel. if you can do a good enough history with a patient, you can kind of narrow it down to getting the panels that you think are most likely.
Okay.
If that doesn't pan out, you could get more, but at least you can get us on the map. Now, the problem with IGeneX or any of most of the tests that have been out there is that they're tests of immunity. They measure how is this patient's immune system dealing with what's in their body. And you might say, well, why does that matter? Well, it matters because Lyme disease weakens the immune system to such an extent that it often can't make antibodies at all.
Huh.
So you can have Lyme disease, and it's estimated that 30% of people who have Lyme disease, their immune system can't make antibodies. So you can do this test and it could be negative and you might miss it. So there's an inherent difficulty even in the best tests that are currently on the market. There's a somewhat newer test from T Labs, which can take your blood and look at it under the microscope, exposing your blood to a special fluorescent stain that is specific for the microbe you're looking at, be it Lyme or Bartonella or Babesia. And literally, if you have it, it will light up fluorescent under the microscope. The beauty of that is it tells you that right now there is this microbe in your body because I'm seeing it in your blood. So it tells us that, yep, you have it. With the immunological tests, the other issue with immunological testing is once your body does make antibodies, you will make antibodies for years afterwards. So we don't know when you're done. You could be cured of Lyme and still have a very positive antibody test, but I don't know, is this old Lyme cured or is this still Lyme in your body? So we do need several different kinds of tests to figure out what's going on with someone because it's complicated.
Outside of IGeneX, do you like any of the other panels, such as, say, Vibrant or?
No, I think Vibrant's pretty inaccurate. Never found that. And what I'm giving you is consensus, which is these are not just my opinions. I do a lot of teaching, and this is the opinion of most of the people that I practice with, work
Right.
with, and work in this field.
Do you like Dr. Vastani's lab?
It depends on what we're using it.
Okay.
I know Dr. Vajani very well. I did research with him, I don't know, 25, 30 years ago.
Oh, okay.
And I just had a lovely conversation with him at an ILADS meeting just a couple of weeks ago.
Oh, okay.
He's a very, very good immunologist, and some of the labs that he's put together are really excellent. He's got a new test, by the way, which I'm pretty excited about, which is he can now measure a toxin made by Candida called candidolysin to help us to know in those patients with Candida how they're struggling. He also has in his new test, we can now tell in patients who are somewhat sensitive, we can now measure whether or not they're making antibodies to Saccharomyces boulardii, so that if they are, we don't want to use it as a treatment. If they're not, it could be a very valuable treatment.
Oh, interesting.
And these are brand new tests, right 2 weeks old now. So I'm excited that we have some new tools to work with.
And is he offering those through Immunosciences or through Cyrex?
Through Cyrex.
Okay. So when it comes to treatment, well, actually, let's finish testing. So we talked about mold, Lyme. What about mast cell activation syndrome? How do we know if a patient has that?
Well, we listen to their story. There are tests for mast cell activation, but they are really, really inaccurate. It is well known that when mast cells get activated, they can release over 1,000 different biochemical mediators into the bloodstream, so that's a very transient, fleeting event. So if you're going to draw their blood and measure something, you have to catch it in the act because if you catch it later on, it's going to be negative. The testing also involves having access to a special cold centrifuge, which very few labs have. And if not done with a cold centrifuge, you're not going to get accurate results. So there are tests for it, but they're fraught with difficulty. And I have a problem with, in the last 8 years, mast cell activation has gone from obscurity to being a hot item that we're all talking about. And every teaching hospital in the country now has a mast cell activation clinic. Their problem for me is they rely on the lab tests, which I've said are highly inaccurate, to make the diagnosis. I've had countless patients with obvious mast cell activation told by those clinics, well, you can't have that because your tryptase isn't high enough.
Right.
And I don't know when medicine got to the point that it relied so thoroughly on a number on a piece of paper that we stopped looking at the patient and went, this is obvious. I don't need a number on a piece of paper to tell me you have mast cell activation. No, and mast cell activation is far more common than we ever thought. It is now known that 17% of the population has it. So it's not rare, not in any way, shape, or form. And if you have it, the most obvious symptoms would be like immediately after eating, getting flushed, red, itchy, hives, abdominal pain, cramping, diarrhea, any symptom which comes on immediately after eating is mast cell activation until proven otherwise. And again, I've had countless patients with these obvious symptoms that are getting told by these clinics, no, you can't have mast cell activation. And that's really doing people a disservice. The other piece to it is anyone who's had mold toxicity or Lyme long enough will eventually get mast cell activation. That the prolonged inflammatory process that constitutes mold toxicity or Lyme will eventually trigger it. So I would say 70 to 80% of my patients with mold toxicity have mast cell activation. I don't have to go looking for it. It's right there.
Interesting. So when you have a complex patient, and let's say this patient has mold toxicity, they have Lyme or Bartonella or one of the other Lyme co-infections, and they have mast cell activation syndrome, how do you determine where to start?
Well, as I'm kind of hinted, you start with a really good history.
Of course.
Well, in managed care where you get 7 to 10 minutes per patient, it's not possible.
Yeah, no, we're talking about now in a functional medicine practice.
Right. So you need to ask the right questions. I mean, as long as I've been in this field, it wasn't until 2005 that I learned about mold toxicity. So until then, I wasn't asking people, do you see mold in your house? Do you smell it? Have you ever lived in an environment that had mold? Have you had water damage or leaks in your home? These are now basic questions, which I didn't ask back then because I didn't know about it. And that's where we all start from. So it's asking the right questions, really getting detailed symptoms so they can begin to point you in certain directions. Although mold, Lyme, and Bartonella have very, very similar symptoms, they're not exactly the same. There are certain symptoms that will point you in one direction or the other if you're just taking a really good history. I mean, for example, if someone has extreme sensitivities to light, sound, food, smells, chemicals, EMF. If someone has an extreme sensitivity, that's almost always mold and Bartonella. If someone has, I talked about before, ice pick-like pains or electrical sensations, that's almost always mold. If you have a vibrational sensation, that's mold or Bartonella. If you have joint pain, severe swelling of the joints, and it moves around, more often than not, that's Lyme, can be Bartonella, can be, and so on. I mean, we can go through this for every symptom that exists, but the more you study these patients, the more you begin to see patterns, so that as people are describing what's going on for them, you can almost always go, this is a mold patient, and I think they also have Lyme and Bartonella because some of their symptoms don't fit neatly into either category.
I've really been enjoying this discussion, but I just want to take a few minutes to tell you about a product that I'm very excited about. Imagine a device that can help you manage stress, improve your sleep, and boost your focus, all without any effort on your part. The Apollo wearable is designed to do just that. Created by neuroscientists and physicians, this innovative device uses gentle vibrations to activate your parasympathetic nervous system, helping you feel calmer, more focused, and better rested. Among the compelling reasons to use the Apollo wearable are that users experience a 40% reduction in stress and anxiety. Patients feel that they can sleep. Their sleep improves up to additional 30 minutes of sleep per night. It helps you to boost your focus and concentration, and it's scientifically backed. And the best part is you can get all these benefits with a special $40 discount by using the promo code Weitz, Weitz, my last name, at checkout to enjoy these savings. So go to Apollo Neuro and use the promo code Weitz today. And now back to our discussion. So what I'm hearing from you is you treat each patient differently, and you might prioritize the mold in one patient or prioritize the Lyme or the mast cell in another patient?
Well, I'm going to take a step back. I only partly
Okay.
answered your question.
Okay.
Let me see if I can do a better job. Many patients with mold toxicity, Lyme and Bartonella, will develop, as we've been talking about, mast cell activation.
Okay.
But they may also develop limbic and vagal dysfunction, so that most of the people I see who are very sensitive have limbic, vagal, and mast cell issues. If they do, that's what needs to be treated first. If you try to jump in and treat Lyme with antibiotics or mold with antifungals, you're going to make those people really sick, and you're not going to get them better, because first you need to quiet the limbic, vagal, and mast cell issues before they'll be able to take what they need to take to get well. If someone has mold and Lyme and Bartonella, I almost always treat the mold first.
Okay.
A couple of reasons for that. First, mold treatment is much less invasive to the body. That when you're using long-term antibiotics, which we do for Lyme and Bartonella, there's a risk that we're going to mess with the biome, that we're going to cause dysbiosis. And to avoid that risk, that's not going to happen with mold treatment. So I generally treat the mold first. If I do, because I can't tease the symptoms apart that well, if we get the mold layer out and someone is completely well, we don't have to go down the Lyme rabbit hole. But if someone was 70% better treating the mold, the symptoms that emerge tell us what layer is underneath that, and then we can treat that way more effectively, because we're not having to treat the inflammation from the mold and the inflammation from the Lyme. So our treatment will be much more effective and much more directed. So I usually recommend treating mold first, then Lyme.
Okay, so let's go into treatment. So you have a patient with mycotoxins. Do you have them assess their home or office and find out where they got it from first?
Absolutely. That's the most difficult and super important, because if they are being exposed ongoing, no matter what treatment I give them, it's not going to work. So
Right.
you can't get better if you're living or working in a moldy environment. So step one is evaluate home, work, car, even take a history. Do you spend time in your parents' house every week for dinner, or a friend, or church, or school where you might be getting it? We need to know where you're getting the mold from and get you out of that environment. That's absolutely crucial.
And let's say you have a patient and they're really sick from mycotoxin poisoning, and they're in the process of figuring out where the mold is coming from. Do you start treating them then, or you wait till they get the mold out?
No, I start treating immediately.
Okay.
You can stabilize it, and many people can get a bit better in once you're treating it. So to me, depriving people of treatment doesn't make sense to me, and it's not a good strategy. It's not going to work the way you want it to until they get out of there. But to make them suffer until they get out, sometimes that's very difficult. Sometimes people have financial constraints, social constraints. It's not always easy for people to walk away from a particular environment or afford the expensive remediations that necessary to get that building fixed. It's difficult. So no, I think it's an important point. Yeah, once you know what you got to start treating it.
So it's common in the functional medicine world for treatment for mold to include glutathione, liver support, binders, other parts of the treatment. What are some of the go-tos for your treatment protocols?
Well, the way I look at it, there's three main components to treating mold. The first we've talked about, which is you've got to go over the patient's environment and be sure that they're not getting exposed.
Right. So remove the mold.
Second, you want to use binders that are specific for the mycotoxins that they have on their urine test. And again,
how do we know which binders to use for which type of mycotoxins?
Well, we've done a great deal of research on that, and thank you for asking. In my second edition of Toxic, which just came out a couple of weeks ago, we have an elaborate table of all of the research that's been done in this area, which shows which binders work best for which mycotoxins. So if you get a urine mycotoxin test and it shows that you have ochratoxin, trichothecene, gliotoxin, you just look at those on the table and you go, okay, ochratoxin. The best binders for ochratoxin are cholestyramine, Welchol, and charcoal. We go to gliotoxin. The best binders for gliotoxin are Saccharomyces boulardii and bentonite clay. So we can be very pinpoint about which binders we want to give to get the mycotoxins out of the body. The third part, and it doesn't apply to everyone, is if you've colonized, if mold is now growing in your sinus and gut areas, you're going to need antifungals, either by nasal spray for the sinuses or oral medicine for the guts to get the mold out of the system. Those are the most primary interventions. Now, there's lots of other things you can do to help people detox better, to get them better, and then it just depends on what that particular patient is wrestling with and what they need. For example, glutathione is very good to mobilize toxin, get it out of the body. With most of my patients, glutathione will do that, but it'll mobilize the mycotoxins to the point that their body can't process it and they will get worse. It'll literally make them more mold toxic because they're mobilizing the toxin and their ability to detoxify is so compromised that they can't get rid of it. So they'll get worse. So most of my patients can't take glutathione. If a patient can, great. But you got to know if they can or not, because this is not a rigid treatment algorithm.
But isn't that why you want to combine the glutathione to mobilize the toxin and then the binder to grab onto it to help remove it. And then some practitioner strategies are also to use something like herbal bitters or something else that mobilizes the bile, because the toxins end up in the often in the stool, and the bile helps flush it out.
All of that is correct, but it depends on the patient's ability to do what you're asking them to do.
Okay.
For example, if you give them too much binder, then they will mobilize toxin faster than they can process it, and they will get worse.
Okay.
They will not. Some of them have this idea, well, if it makes me worse for a while, that's fine. I'll just get better faster. They won't. They'll just get more toxic. So each patient has to be looked at individually from their capacity to handle what you're doing for them. So that's true, for example, for a sauna, which is a good way to detoxify. But some of our more sensitive patients can't take a sauna without getting worse. Or maybe they can do a little bit of it, like 5 or 10 minutes at infrared low temperatures, and they can't. So again, you've got to look at it individually for each patient about what can they do. You can't use a one-size-fits-all algorithm or strategy, because a lot of people, if you're going at it too hard, will get worse.
What about using a combination of binders, like in one formula that has charcoal and clay and, a number of different things?
That's fine for people who have a strong constitution.
Okay.
But for people who are sensitive, you can't control the amount of binder that they're getting. And honestly, you can't even know how much they are getting. So for example, there's a number of combination products on the market, but none of them can tell you exactly what's in there because they're all proprietary. I mean, I'm friends with Chris Shade, who makes Ultra Binder.
Right.
But he won't tell me exactly what's in there. None of the proprietary folks will tell me the exact amount.
Okay, so they tell you the different binding agents, but not exactly how much of each one.
Right. So if you're trying to tweak it, and you often have to with mold toxic patients, they might be able to handle a little bit of clay and more charcoal, but I can't control that with a combination product.
Okay.
So most of the people I treat are, again, very sensitive, and I need to introduce each binder in tiny amounts and slowly increase the dose to find out how much can they handle comfortably without getting worse, and just slowly layer the different binders on. If someone has a strong constitution, and I don't see those patients, yes, you could give them, GI detox or ultra binder or any of the combinations that are out there. That's fine for people who can do it. But I'm just putting in a word of caution that not everyone can do that.
You mentioned Saccharomyces boulardii, which most of us think of as a probiotic. Actually, it's a healthy yeast, but can you explain how it functions also like a binder?
It has two functions in mold toxicity. One is, and we've used it this way for decades, to flood the GI tract with a good yeast, and then it ecologically pushes candida and mold out. There's no more room for it in that environment. Second,
by the way, when you say a good yeast, that's the same thing as saying a good fungus.
Yes. I mean, the word fungus isn't a dirty word.
No, I understand. Not everybody knows that yeast and fungus and the same thing.
True. But I'll leave it at that.
Okay.
I'll leave it at that for right now. The other mechanism of action is we now know that the cell wall of Saccharomyces specifically binds gliotoxin and zearalenone. So two of the common, more toxic mycotoxins is specifically bound by Saccharomyces.
When you have a patient with mold, but they also have constipation. We know that binders tend to constipate. How do you counterbalance that?
Primarily with regulating the dose of magnesium and the dose of buffered powdered vitamin C.
Okay.
Basically, magnesium taken orally has no side effects other than loose stools and diarrhea if you take too much.
Right.
So you can literally titrate bowel movements to the dose of magnesium. So many of our patients are on pretty good doses of magnesium and adding some buffered powdered vitamin C. That will work for most.
And do you have them take that at the same time as the binders or at a different time?
You generally would take that at a different time. But again,
Okay.
timing of the binders is separate and different, meaning charcoal, clay, and chlorella are all negatively charged and can be taken together once a day, usually away from food and away from other supplements.
Right. So what do you say, 30 or 60 minutes before meals or what?
2 hours before and 2 hours afterwards.
2 hours before and 2 hours afterwards.
Right.
So that's kind of tricky if you're eating multiple times a day.
Well, we're not talking snacking. We're talking meals.
Okay. All right.
The Saccharomyces I usually recommend taking with food, and I usually recommend Welchol and cholestyramine with food.
Okay. So what are your preferred treatments for Lyme and Bartonella? And you don't mention the other co-infections that often. You don't think those occur as frequently or don't create as many problems as Bartonella?
In my experience, Bartonella is the most common and one of the hardest to treat.
Okay.
Babesia is common, and we do treat it a lot. Some of the other co-infections like Ehrlichia and Aplasma, they're much rarer. Yes,
Okay.
they're rare, but for some of these discussions, I try to keep it simple, even though it's never simple, and not to make it any more complicated than it already is. So I don't want to throw around big words that a lot of people aren't familiar with.
Okay.
Talking about it. But yes, they're there and they need to be at least looked for in some people when they're not responding to what we're doing.
Right. So you like to treat Lyme and Bartonella with antibiotics, even when these are chronic infections?
Yeah, absolutely. In my experience, although I will add herbal and homeopathic treatments to what I'm doing, the vast majority of people will not get well if we're not using antibiotics.
What are your preferred antibiotics for Lyme
Well,
and
again,
Bartonella?
it varies. For Lyme, I'll usually start people on a triple antibiotic treatment. Understand that Lyme is a very unique bacteria. It's intrinsically a spirochete, like syphilis, but it can change its shape and form into what's called a cell wall deficient form, and it can form a cyst form. Each of those forms have different responses to antibiotics. So if you only used one antibiotic, the Lyme will protect itself by changing its shape and form, and then what you're giving it's not going to work anymore. So typically we have to use 3 different families of antibiotics in order to really get at Lyme. And typically I will start with Omnicef as one of my antibiotics, either doxycycline or Zithromax, and then Tindamax or Flagyl for the cyst form. So those are the families that we'll be working with and treating it. And then I will typically add tinctures of different types that are specific for helping getting rid of the body. I like the Beyond Balance tinctures for Lyme and for Bartonella and for Babesia. I like the Byron White tinctures. The Beyond Balance tinctures are a little gentler. So again, depending on my patient's constitution and sensitivity. I like the Nutrimetics herbals as well. So often we're trying to support not just the antibiotic treatment, but to support their ability to detoxify at the same time. Because we know that if we're killing bugs, we have to keep in mind toxins are being released, then we have to help our patients release those toxins at the same time. If I were treating Bartonella, I liked Dr. Robert Mozzaiini's protocol particularly well, which is using Bioxin and rifampin. I also find Septra very helpful. And for people who have persister cells or aren't getting better, Rich Horowitz's double dapsone program is very effective.
How do you avoid having somebody's microbiome negatively affected by these antibiotics? And I'm assuming you're doing these antibiotics for prolonged periods of time.
Yeah, we are. And people used to get on me when I started this work, and they'd say, Neil, I thought you were holistic. How can you use long-term antibiotics? And my answer was, I think I am being holistic. I'm trying to use the safest, best treatment on a particularly tough thing to eradicate, and this is my best, safest treatment. Over the years, very, very, very few of my patients have gotten a messed up gut from using antibiotics. A
Okay.
few, but very few. But usually it's because I'm supporting them with lots and lots of probiotics from the get-go. So if you're going to be taking antibiotics for any period of time, you really need to support your gut.
Are there particular types of probiotics you like to use, or do you base which probiotics on stool testing or anything like that?
I'm not sure that stool testing is adequate to tell me which antibiotics they should use. I think, although we have elaborate information, I'm not convinced that information is clinically as useful as we hope it would be.
Okay. So which probiotics do you use?
Well, first of all, I'm very fond of spore biotics.
Okay.
So Megaspore is one that I've used for a long time.
Yeah.
I like Visbiome, which is a really good comprehensive probiotic as well. But there's many other good ones that are on the market. I
Okay.
like to use different probiotics in the same person so that we can try to match what they need in their gut by giving them a lot of variety to look at, not using just one kind of probiotic, but multiple so that their gut can choose, yep, I want and I need that one. No, I don't need that. But they get more options.
Okay. How do we treat mast cell activation syndrome?
First of all, it's important to know that mast cell activation doesn't exist in a vacuum.
Okay.
That we need to always be treating what's triggering it or causing it in the first place.
So mast cell activation is typically being triggered by something like mold or Lyme, or
yeah.
What about are there other triggers?
Oh, there's plenty of other triggers. EMFs can trigger it. Other infections can trigger it. But you need to find the trigger and treat it. And I would say categorically that mold and Lyme and Bartonella are by far the biggest. That if you have mast cell activation, you're going to see mold toxicity 80% of the time is the cause. And so if you're not treating the cause,
Okay.
we can treat mast cell activation, but it's like putting a Band-Aid on a physiological process when you could cure it if you were figuring out what was setting it off in the first place. Second, mast cell activation is almost always intimately interwoven and interconnected with limbic and vagal dysfunction. So if you're not treating limbic and vagal dysfunction at the same time that you're treating mast cell activation, often the treatment will not be anywhere near as effective. So it's like a package deal. All three systems are completely interconnected. But to answer the question most specifically, because mast cell activation is so complicated, in order to treat it effectively, you have to come at it from multiple directions. So you're going to want to be on an H1 and an H2 receptor blocker, a mast cell stabilizer. You may want to use diamine oxidase, DAO, to help with that. A tryptase inhibitor like All Clear, PEA derivatives. So the more components, leukotriene inhibitors can be helpful here. So you want to come at it from multiple directions. A single agent is rarely going to be capable of getting mast cell activation under control.
What about natural agents like quercetin, vitamin C, other natural agents?
Yeah, quercetin and paramine, which is a perleseed extract,
Right.
are great mast cell stabilizers, and I use them a lot.
Okay. Have you tried the quail egg product?
Yeah, that's All Clear. I referred to tryptase inhibitors, and
Oh, okay.
That's what All Clear is.
Oh, okay. Yeah. So let's see. For limbic and vagal nerve issues, how do you handle those?
We treat them. We reboot it.
Okay. What are your favorite ways to reboot the limbic system?
One more time, it depends on the patient.
Okay.
When you talk with a patient, you get a feel for what system might resonate for them the best. So there's a number of limbic rebooting systems out there right now. Probably the three most prominent are Annie Hopper's dynamic neural retraining system, Ashok Gupta's amygdala retraining program, and Primal Trust by Kathleen King. Those are my three go-tos. There's some very patients with very strong Christian beliefs who are concerned about. They have a feeling that some of those other systems are a little bit too new agey for them. Brooklyn Hanna has a limbic rewire that's attuned to that. So you give the patient the system that you think they can work with the best. For example, I talked with a fellow earlier today. We consulted, and he's got so much cognitive impairment from his mold toxicity that he tried Primal Trust, but it's too complicated for him and he can't do it. So for him, I'm recommending Ashok Gupta's program, in which he doesn't have to do anything but listen to these guided visualizations that Ashok has put together. For other people who want to be more active in what they do, Annie Hopper's program is excellent. Primal Trust is excellent. So again, you kind of have to tailor make what you're offering people to your sense of their personality, their cognitive ability, their physical abilities, so that they're able to do what you're asking them.
And when it comes to vagal nerve stimulation, there's a lot of talk about that, especially in the world of gut health. And people have come up with devices that you put over the vagal nerve. People are using other forms of stimulation of the vagal nerve. What do you like for stimulating vagus tone?
One more time, depends on the patient. So most of the people I treat are really sensitive, because that's what I get referred to over time. Those folks can't handle the direct stimulation over the vagal nerve or the ear device, which is a branch to the vagus nerve. Those are for people who have a stronger constitution.
Okay.
With my sensitive patients, I like Apollo Neuro, which is a band on the wrist that vibrates and you can control what it's doing. That is the one that I use the most. Others are fine. It's just that I don't see patients with strong constitutions who can handle anything I want to throw at them.
Right. Cool. Yeah, I like the Apollo. What are some of the common mistakes you see practitioners make when they treat patients with complex chronic illness?
I think the single most common mistake is not identifying root cause. meaning I've had people treat Epstein-Barr and methylation dysfunction and mitochondrial dysfunction for years because they're missing the fact that they've got to treat what's causing it. Once again, mold and Lyme being the most common. Another common mistake is in the functional medicine world, we're taught that treat the gut first, everything will follow. The exception to that is mold toxicity. So if someone has mold and candida in them, you can do every one of the common interventions we use to get the gut functioning better. It won't work until you get the mold and candida out first. So one of the things that I see is people being treated for years for SIBO and not making much progress because they're, again, not treating the cause. Another common mistake is when people start learning about mold toxicity, they'll often start treating with antifungals before they have binders on board or before they have the system settle down. And if you, in my world, binders have to be in place before you use antifungals, or you're going to risk a serious, nasty die-off.
So you use binders. Do you use any other support strategies while you're using the binders?
Again, one more time, it depends on how sensitive the patient is.
Sure.
Sorry, I'm a broken record in that category.
Yeah, no, I know that's your deal is dealing with these sensitive patients that a lot of us have had to try to deal with and find super challenging.
So some people need some extra work on detoxification. They need to have their liver supported. They need to have their gallbladder worked on by taking bitters or improving bile secretions with phosphatidylcholine. Some people need to have their kidneys supported, the lymphatic supported, lymphatic massage. I'm fond of some homeopathics that work on all of those. Some of the Picana remedies like Epohepat and Itiris and Renilix kind of can combine some of this improvement in detoxification. You want to support
adrenal function.
Well, we didn't even talk about that. Mold and Lyme mess with the pituitary's ability to regulate hormones. So you're always going to be wanting to look at adrenal, thyroid, and sex hormones and support those if they need help. I mean, it's a complicated thing. It's not like you can take one pill and get well.
Right.
You have to understand its complexity so that you're working on all aspects of it so that people can really get well. It's not simple, but my take-home message for everybody is every single thing I've talked about today is treatable. So, I mean, I've personally treated successfully 4,000 or 5,000 people with mold toxicity and 4,000 or 5,000 people with Lyme disease. So we can treat these things. The key is to get the correct diagnosis and go after it in the correct way. And if you can do that, then people can recover their health, even if they've been sick for a long time.
And it sounds like one of the themes we've had from this conversation is a lot of times mold can be the underlying cause of a lot of these other conditions.
It can be. Just statistically, it's known that over 10 million Americans are suffering with mold toxicity right now. And the vast majority have never heard of it, have no idea that that's what's making them sick. So my hope is simply to raise consciousness about this is very real, it's very treatable, but you need to get into the hands of someone who knows what they're doing if you're going to have any hope of getting well.
Yeah, I asked for some questions from our functional med. I administer a closed Facebook page for functional medicine practitioners, and it's called the Functional Medicine Discussion Group of Santa Monica. And one of the questions that somebody asked me to ask you was about chemtrails. which I personally don't really understand or know anything about.
Well, one more controversial thing that I don't know that I have the definitive answer. Um, Chemtrails, there's some research that suggests that chemtrails involve the deposition of heavy metals like barium into the atmosphere. And there's a neurologist working in the Mount Shasta area at high elevations who found extremely high levels of barium in the soil and barium in areas with the planes flying over it regularly. And then when he did studies on patients, many of the sicker ones with neurological illness had some issues with barium particularly.
Hmm.
To me, it seems like something that needs to be studied more thoroughly. If you read I don't know, the conventional view of it, it's just water vapor that's being deposited. A number of people are getting sick from chemtrails, and I think, like everything, we need to study it more intensely and put some research into it because I think it's a real thing.
Right. Okay. Great. So any final things you want to tell our listeners and viewers?
I just hope that this discussion has opened your eyes to the fact that if you or a loved one is suffering with any kind of a chronic medical condition, think about mold, think about Lyme as possible causes because we can treat that. And I can't help but plug my books, which is if this is of interest, the second edition of Toxic just came out, and it will cover this field pretty thoroughly. And for those of you who are particularly sensitive, my book, The Sensitive Patient's Healing Guide, discusses what causes the sensitivity and how to treat it in more detail. So those are just resources that I hope people can find helpful.
You know, we started talking about mast cell activation syndrome, but we really didn't get into the treatment. Maybe we could just spend a few minutes just mentioning some of the highlights of the treatment for mast cell.
Well, I thought we did. I thought we talked about H1 and H2 blockers.
Oh, yeah, we did. That's right. Yeah. Okay. Yeah, good. Okay. So best way to get in touch with you through your website?
Website's really simple, neilnathanmd.com.
Great. Thank you so much. Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would very much appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. As you may know, I continue to accept a limited number of new patients per month for functional medicine. If you would like help overcoming a gut or other chronic health condition and want to prevent chronic problems and want to promote longevity, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a consultation for functional medicine. And I will talk to everybody next week.